I call upon Dr. Mohsin Quadri for his talk on marketing your new setup.
Good afternoon, respected chair and dear delegates. Myself, Dr. Mohsin. I'm a urologist from Guntur city of Andhra Pradesh. Today, my talk is on marketing your new setup, digital and physical marketing for running your own clinic. No conflicts of interest. So as a urologist, I can touch up superficially on what is marketing and what is digital and what is physical marketing and how it helps in running our clinic. At the same extent, I want to quote NMC guidelines regarding the marketing. So first of all, what is marketing? It is the action or business of promoting and selling products or services. It includes marketing, research, and advertising. Physical marketing is otherwise called as traditional marketing, which refers to the marketing which is not online. It means the print, broadcast, direct mail, phones, outdoor advertising like billboard, and from newspapers to radio. This is a lot. It reaches to a lot of target audiences. As I said in the previous slide, various means of physical marketing, that is traditional marketing, that is newspaper, magazine, flyers, brochures, radio, TVs, and on billboards. Digital marketing, the term digital marketing refers to use of digital channels to market products and services in order to reach consumers. This type of marketing involves the use of websites, mobile devices, social media, search engines, and other similar channels. So these are the type of digital marketing. I'll start from content marketing, where content, a concept has been selected, and that will be promoted in the public and it will be marketed. At the same time, email marketing is where there is a lot of database of emails, and the latest products, everything will be get notified to the subscribers. As well as influencer marketing is type of marketing where a person who markets is not a celebrity, and a person who chooses a product will likely in recent days we see a lot of Insta and Facebook. Many people are advertising the selected product and advertise that will become popular. That is type of influence marketing. And coming to viral marketing is concerned, this is a kind of a marketing where a group, a set of people suddenly focus on a thing. Like suppose, for example, electric vehicle is there. A group of 1,000 people suddenly tweeting about viral market, this electric vehicle. And suddenly the attention of a person who is not in search of that also will get the attention of that. Similarly, mobile marketing, where this is marketing entirely depends on whatever say apps or SMS, anything that relate to mobile and tabs. And electronic billboards and search engine optimization is one of the thing where in the Google search or any search engines, we can manipulate the content. And pay-per-click is concerned, it is a type of marketing where whenever a person clicks on the advertisement, the advertiser needs to pay to the publisher based on the clicks of ads. And finally, the social media marketing, what we are focusing on. So these are all 5 main social media streams which are essential in marketing, out of which Facebook, YouTube, and Insta are usual users are youngsters, teenagers, and youngsters. Whereas Twitter is concerned, educated people as well as wealthy people and few middle-aged people as well. Whereas LinkedIn, it's mainly by professionals and middle-aged group of people. Most of the marketing, what we see as for patient base is concerned, Facebook and Insta, and then is YouTube. So this is the strategy of social media marketing. First, we need to optimize the profile. So we need to create our profile first, and we need to add our websites, whatever other social media links to a main profile. And we need to post a useful information like any advertisements or like any awareness videos or any small short clips, which is useful to public. We need to post it, and we need to measure, we need to engage how people are engaging, like how many likes we are getting, how many shares, how many comments, and whether we are getting followers are being added or not. We need to check it. And we need to advertise this by, they are called paid promotions, where we can pay money based on that money scale. The number of the it reaches the people of, and finally we can measure with the help of analytics in settings of each and website, we have analytics. We can see this post reached how many people liked it, how many of the new followers. We can do analysis. And the prerequisite of promotion is establishing a new setup is first a logo. A logo should be unique, and we need to have a name and the location well ahead of starting your clinic. These are the prerequisites to start promotion. For any promotion, personal, physical meet is very important. For example, if we're starting a clinic and we need to really meet colleagues or first or doctors first, those who are who refer our patients first, like those who are senior MBBS practitioners or those who are like general physician surgeons who will refer to our cases as, and not only them, as well as our radiology colleagues and our pathologists or microbiologists, whoever, we need to meet them in person. We need to request them to attend our clinic. At the same time, we need to, we'll meet the heads of so-and-so departments like municipal office, DMHO, fire safety department, whatever statutory bodies we need for a clearance of a clinic, we need to meet them. And as well, finally, the local heads like some corporator or village head or mayor, MLA. By calling these people, there will be more footfall to the clinic, and that itself one of the promotion. And coming to promotion via print media, newspapers is a mainstay, newspapers, magazines, whether weekly or monthly magazines, and distribution of flyers, brochures in public places. And flexi boards, as we see, there were a lot of hospital ads and flexi boards like in our local areas at near signals, in very crowded areas, as well as we are surprised to see many such flexi boards even in nook and corner, like any villages or nearby. Were crowded nearby villages of the practice. And stickers, placing the stickers in public places like tea stalls and behind the autos. I have seen many ads of hospital ads behind the autos. And distributing the referral pads to people people were outreach, like medical shops or labs where people they reach for casual blood tests or some medicines. These people can help you give their stickers from the referral pad so that they can reach your clinic. Coming to electronic media, TV channels where they're either in the form of a scrolling ad or in the form of a 2 minutes or 3 minutes ads in the TV channels. And it is a mic canvas. This will be in towns. This is a very popular way of communication and promotion. And if we have a patient database, then based on their numbers, we can send bulk messages as well as phone calls that we start up a new clinic. And as we are aware that these days there were a lot of awareness talks in FM radios, as well as few ads as well. Coming to digital media, this is a mainstream. As I said in my previous slide, Facebook, Instagram helps a lot, as most of our patients like our page, they follow us, or they send friend requests, and whatever post we put, they will see, they will like, and they will forward. As well as in Facebook and Instagram, there are like stories which stay for a period of 24 hours. Whatever the update you put, whatever the clinic location, whatever the thing, whatever the achievement, whatever the message you put, that will be in the stories for a period of 24 hours, and the people will see and they will like it, as well as the posts which will stay on your wall forever. And in Instagram, there are a thing called Reels, where we can really share educational video of like a minute or 2 minutes. And Twitter tweets won't help much in building a practice, but really Twitter is a lot for our young urologists to learn tips and tricks. Like Dr. Said is here, Dr. Tanuj sir, and many other respected people outside the dais also. They share a lot of tips and tricks and troubleshooting that we help, that it helps our young urologists to build our clinical knowledge and clinical skills. YouTube uploading videos of whether awareness videos or short clips that helps in promotion. And LinkedIn posts, as the LinkedIn post is purely a professional marketing, that is that not helps much in patient building, but the HR people, employer people will be seeing whoever doctors are there, and that's a place where employers will catch. And WhatsApp, coming to WhatsApp, there is a business profile that is a very exclusively good profile. So in this business profile, we can add our name, degrees, and everything, our credentials there in the respected columns below, and we can mention our clinic timings, mention our fees there, A patient, when he goes to our profile, he gets in and out of the detail. Every detail we can paste it there, and he can understand everything from there, business profile. And whenever patient messages to the number also, there is a profile called a welcome message, such that whenever patient message, it will say thank you for contacting and so, and we can respond it later. That is a really very good big feature of business profile. And whatever statuses we keep, if we feed our patient phone numbers, and whatever status we keep, the patient also will actively seeing, and they will be commenting, liking. And Telegram is concerned, not much special, but there is a option of bulk messaging and forwards. And now here I am attaching the recent National Medical Commission Registered Medical Practitioners Professional Conduct Regulations. This is a recent one, and I'm reading these above points. Registered medical practice, the restrictions, there are some restrictions on advertisement. Kindly listen carefully. Registered medical practitioner is permitted to make a formal announcement in any media, whether print, electronic or social, within 3 months regarding the following: on starting a practice, on changing a type of practice, on changing address, on temporary absence from the duty, on resumption of practice, on succeeding to another practice, and public declaration of charges. In this time only he is permitted to do a formal announcement. And printing of a self photograph or any such material of publicity in the letterhead or on a signboard of a consulting room or any such clinical establishment shall be regarded as act of self advertisement and unethical conduct on the part of the physician. However, printing of sketches, diagrams, pictures and human system all shall not be treated as unethical. A RMP or any other person, including corporate hospitals, running a maternity home, nursing home, private hospital, rehabilitation center, or any type of medical training institution, etc., may place announcements in the lay press, but these should not contain anything more than the name of the institution, type of the patients admitted, kind of training, other facilities offered at that place, and regarding the fees. A RMP is allowed to do public education through media without soliciting patients for himself or the institution he is working. And the conduct of registered medical practitioners on social media, these are the 3 key principles. The broader principle of medical ethics should guide the use of social media by RMPs. RMPs need to distinguish between telemedicine consultation and social media. All written and visual communication should be truthful, respectful, and professional. The conduct, RMPs can provide information and announcement on social media. However, the information should be factual and can be verified. The information should not be misleading or deceptive, nor should it exploit the patient's vulnerability or lack of knowledge. RMP should avoid discussing the treatment of the patients on the public social media or prescribing the medicines to the patient on the public social media. If a patient approaches doctors through public social media, the doctor should guide the patient towards a telemedicine consultation or in-person consultation as the situation warrants. RMP should not post patient's photograph or scan images on the social media. Once an image is posted, it will be owned by a social media company or by public. So RMP's behavior on social media towards his colleagues should be guided by general principles of medical ethics on professional behavior. RMP should not directly or indirectly indulge in practices of purchasing likes, purchasing followers, or paying money so that search algorithms lead to their name being listed at the top or registering on the software programs that charges fees for higher ratings or soliciting patients. RMP should not request or share patients' testimonials or recommendations or endorsements or reviews in the social media. RMP should refrain from sharing images of healed or cured patients or surgery procedure videos or images displaying the impressive results under any circumstances. RMP is allowed to share educative material for the information of the general public. However, communication should be limited to the expertise. RMP's webpage should also follow the same guidelines as above. On social media, RMP should refrain from boundary crossing or violations and conduct themselves with dignity and decorum. Soliciting of patients directly, indirectly through social media is unethical. My take-home message is, marketing is need of hour in this current era of competition. Both the physical as well as digital marketing are essential and need to go hand in hand for the promotions. Whatever the marketing tricks may be, should not violate the National Medical Council, Registered Medical Practitioners Professional Conduct Regulations. Thank you one and all for your patient listening. Thank you
Dr.
USI and Youth USA for giving me this opportunity, and Jai Hind.
Thank you, Dr. Mohsin. Already covered everything and we are running short of time. So we'll be inviting the next speaker for the
Thank you.
talk now. So we need to know about the statutory